Hi, and welcome to Find What Moves You. In this foundational presentation, I'm going to talk about the need for a program like Find What Moves You, the theories that informed program development, and the logic model that includes the core outcomes of the program. We developed Find What Moves You to address some of the risk factors that can make girls more likely to develop things like disordered eating, having negative body image, lower physical activity levels, and higher anxiety and depression compared to boys. Collectively, these changes can be linked to something called negative embodiment. One of the key explanations for these elevated levels of risk is a shift from positive to negative embodiment that occurs for girls around the ages of 8 to 13 years of age and is associated with puberty. During this time, girls start to view themselves more as objects from the outside and value themselves more for their physical appearance than what they can do or accomplish. They also experience a reduced sense of agency, and they're less likely to speak their mind. And finally, they begin to disconnect from their bodies and start to use external rather than internal cues to make decisions about things like how to eat, how to move their bodies, how to learn in the classroom, how to relate to others, and how to be in the world more generally. These changes all represent negative embodiment and can predispose girls to experiencing the negative health outcomes mentioned on the previous slide. Things like anxiety, poor mental health, disordered eating, and low physical activity levels. Therefore, finding ways to support positive embodiment may be key as girls are experiencing these changes during early adolescence. The problem is, there is a really extreme lack of programming for girls that supports these pathways back to positive embodiment at this particular critical stage of development. Just as girls are beginning to face more of these challenges related to their bodies, the way they move, and their sense of agency in the world, prevention programming targeting girls and these specific risk factors tends to decline significantly. So we created Find What Moves You for 12 to 14-year-old girls to help them find ways that they like to move, to connect, and thrive in their own lives. There are three key theories that inform the development of Find What Moves You. First is the developmental theory of embodiment. And this theory identifies three key pathways that an individual at any age can follow to find their way back to positive embodiment or feeling connected and in tune with their thoughts, emotions, and physical sensations. I'm going to talk briefly about how these three pathways show up in Find What Moves You. The primary pathway that we utilize in Find What Moves You is the physical one, and this can be represented by joyful immersion in movement activities. Imagine the kind of movement you might have done as a kid where you completely lost yourself in the movement. You felt joy just being present in your body and you had no sense of self-consciousness, similar to a flow state or how you feel when you're playing. The second pathway to positive embodiment is the mental pathway. This is where we gain an awareness of our beliefs and mindsets that we've often subconsciously absorbed from societal and cultural messaging, such as things like, hey, being thin is more worthy or valuable, or I have to exercise at a very high intensity for it to count. Or, have you heard this one? It's important to be as small as possible if you are a woman. On the mental pathway, what starts to happen is you begin questioning and countering these beliefs to identify what is actually true for your lived experience in the world. And then finally, the third pathway, according to the developmental theory of embodiment, the third pathway back to positive embodiment is the social pathway. This is where close social relationships, particularly with key mentors and peers, serve to provide you with a network of people who support you as you venture along these other two pathways. These individuals might serve as role models Or they might do things like provide you with key feedback and information. In order to give us more insight into how best to support these pathways in our program, we brought in self-determination theory and monitoring and acceptance theory. So let's start with SDT. Self-determination theory emphasizes the importance of feeling competent, autonomous, and socially connected or related in order to support intrinsic motivation, which is the optimal form of motivation, and overall well-being in our lives. In Find What Moves You, we intentionally support competence and autonomy during the movement activities to support intrinsic motivation and joyful movement experiences. We also support relatedness in all of the activities of the program, which in turn supports the social pathway to positive embodiment. And then finally, monitor and acceptance theory, which you see here, talks about the importance of mindfulness for supporting health outcomes. Mindfulness is defined as both the awareness and acceptance of mental and physical stimuli. In Find What Moves You, we teach mindfulness skills during several different activities, which supports both the mental and the physical pathways to positive embodiment. These processes not only support the three key pathways to positive embodiment, but have also been shown to be key factors in supporting overall psychological well-being and thriving in one's life. Here you see the program's logic model of change. This outlines the theoretical pathways through which the program is intended to achieve its short and long-term outcomes. Three primary theories, as I just mentioned, informed the development of Find What Moves You. These appear on the left-hand side of the logic model here. They include the developmental theory of embodiment, self-determination theory, and monitor and acceptance theory. As I just said on the previous slide, the DTE, or developmental theory of embodiment, outlines three primary pathways by which positive embodiment can be supported and can be increased through the use of specific protective factors. These are the pathways of social power, mental freedom, and physical freedom. Each of the program outcomes represents one or more of these three pathways, while also drawing from some of the core tenets of self-determination theory and monitor and acceptance theory. Moving over to the experiential objectives in the second column, these represent the experiences or the really active ingredients of the program that we hope that girls will gain through participation in Find What Moves You. And each of these experiential objectives is designed specifically to support the program outcomes in the third column, and then eventually the behavioral health outcomes in the fourth column. So as you can see, the main program outcomes in column 3 include increased competence, autonomy, and intrinsic motivation for physical activity, increased mindfulness, body appreciation, and increased feelings of belonging and common humanity. Again, each of these outcomes is directly linked to the experiential objectives that we foster in each session of the Find What Moves You program. Finally, on the far right-hand side, the longer-term behavioral health outcomes that are anticipated to occur due to these active ingredients in the program include positive physical activity behaviors, mental resilience skills, positive body image, and lower disordered eating, as well as relationship skills. In closing, Find What Moves You is theory-informed, supported by research on positive embodiment, mindfulness, and intrinsic motivation for physical activity, and has a clearly articulated logic model that illustrates the proposed mechanisms for change that supports program outcomes